Dr. Fauci, always good to talk to you.
Good to be with you, Jim.
All right, top of minds for many parents today. Kids are going back to school. Many have been back in school for a couple of weeks now. How much should we expect an increase in infections among children under 12 not yet vaccinated as they go back to school, particularly in many states where they're not even allowed to require masks, for instance, in school? How concerned are you?
Right. Well, that's the issue that you just mentioned, Jim. If we do things right, we hope that we don't see much increase at all. If we want to protect the children, particularly those who are not yet eligible for vaccination, you want to surround the children with people who are vaccinated, teachers, school personnel, everyone else. But also, in order to protect those who can't get vaccinated, there are certain simple things you have to do. You mentioned one of them, universal masking in the school. And even though there are, some government leaders locally who are trying to push back on that, we've got to get the school system masked, in addition to surrounding the children with vaccinated people. That's the solution. We don't need to see a big uptick at all in cases if we do it right.
The trouble is, as you know, politics still trump the science, right? You listen, for instance, to the governor of Florida, one of the states, of course, that has banned mask mandates. The way he described vaccinations was really remarkable, and again, defies the science. I want to play it now, just describing who the vaccine is for. Have a listen. I want to get your reaction.
The vaccines have helped people ward off severe illness, and we obviously work very hard to distribute it. At the end of the day, though, it's about your health and whether you want that protection or not. It really doesn't impact me or anyone else.
That's false. Please explain to folks listening right now why that's false.
Well, I mean, I didn't hear him very well from the sound, but I mean, if he feels that vaccines are not important for people, that they're just important for some people, that's completely incorrect. Vaccination, Jim, has been the solution to every major public health issue in which a vaccine was developed for. I mean, smallpox, polio, measles. Yeah. I'm not sure what people are talking about when they push back on vaccinations. It is historically, over decades and decades and decades, shown to be the way you control an infectious disease.
Beyond that, I mean, to clarify, his point at the end there was to say it's just a personal choice about yourself. It doesn't impact anybody else. Explain why that's just not true.
Yeah. Well, that's not true at all. I mean, obviously, it's important for you as an individual for your own personal protection, safety, and health. But when you have a virus that's circulating in the community and you are not vaccinated, you are part of the problem because you're allowing yourself to be a vehicle for the virus to be spreading to someone else. So it isn't as if it stops with you. If that were the case, then it would be only about you. But it doesn't. You can get infected even if you get no symptoms or minimally symptomatic, and then pass it on to someone who in fact might be very vulnerable, an elderly person, a person with an underlying disease. So when you're dealing with an outbreak of an infectious disease, it isn't only about you. There's a societal responsibility that we all have.
Sad fact is a lot of folks aren't making choices based on that science or that responsibility to others in their community. We have the Delta variant. It has been leading to an increased number not just of infections, but crucially deaths. Do you anticipate that in the coming weeks that will tail off at all, that the fall will be worse? Or is it possible it might be better, that those increases, we'll see those graphs kind of come off these peaks?
Well, Jim, it could go either way, and it's up to us. We have the capability within our own selves, our own decision-making process, as to whether or not we wanted to go in the direction of diminution. And we can do that because we have the tool to do it. We have about 75 million people in this country who are eligible to be vaccinated, who are not yet vaccinated. If we get the overwhelming majority of those people vaccinated, we could turn this around even as we go into the cooler weather of the fall. We can do it. It's within our grasp.
Let me ask you this, because beyond that question of getting the portion of the population, about a quarter to this point, who is still not vaccinated, you now have this question of, for the vaccinated, when and how urgently they might need a third shot. I mean, we're moving in that direction. My question is, will it become that this is really not so much a 2-dose vaccine, right, a Pfizer or Moderna, but really a 3-dose, that in other words, you will need that third shot, that booster, to be truly protected from this virus?
Right. I think the latter, Jim. Given the experience I've had over many years with vaccines, it looks very much like it isn't as if 2 doses of a vaccine are failing. It's that the proper regimen will very likely, as we look back on it months from now, will be that 3 doses is really what you should be getting of an mRNA. That might be 2 doses for a J&J, but for the mRNA, we know from studies that are already ongoing in Israel now that when the degree of protection against infection and even severe disease goes down to a certain precarious level, when you give the person that third boost, you dramatically increase the level of protection, even more so than before the boost. It goes up to and beyond the level of protection. So, I believe strongly that ultimately we are going to see that as the proper regimen, 3 doses of an mRNA.
And that's a good point you just made there, that third dose makes you even more protected as an incentive. Trouble, of course, has been some mixed messaging, some movement of the timeline on when that third dose will be fully approved. I know you have said that you still believe by the week of September 20th or close that the White House will be able to move forward on its plan for booster shots. But governors, understandably frustrated about some of this guidance. Have a listen. I want to get your reaction.
We've got people that are well beyond 6 months, that are 60 and older, that need the booster shot. And we can't give it to them because we're being held up by, the nation and on the federal level right now.
We need clear guidance on these booster shots because it undermines, the credibility of it.
When, in your best guess, well, not just governors, but folks watching right now know exactly when and what boosters they will get and should get?
Well, we're still aiming for the week of September the 20th. It would have been optimal to get, at least with the mRNAs, to get both Pfizer and Moderna to roll out the booster program at the same time simultaneously. It looks now it is possible, and I think likely, that you will see Pfizer get rolled out first, because the data that they submitted to the FDA. Remember, you've got to get approval. All of this, Jim, and we said that from the very beginning, is contingent on the FDA regulatory approval and the recommendation of the Advisory Committee on Immunization Practices to the CDC. Pfizer has gotten those data into the FDA. They're going over it now. I think they're going to be on time. Moderna may be a bit behind, but not much. So I think that you're going to get both of them out. They may not be absolutely simultaneously, but it's going to be close.
By the end of this month?
I would hope so. I think they'd probably end no more than a couple of weeks behind, if that much.
Okay. Big picture. There's a question now, right? You're familiar with this, about is there a point where we begin to live with COVID-19 to some degree, that it becomes less of a pandemic response, more of what's known as an endemic response? In other words, it's one of many, those severe diseases, infections we live with. Are we reaching that point?
I think we're going to get there. And as I said before, to an answer to one of your other questions, Jim, we will get there depending on how successfully we vaccinate our population. If we get more people vaccinated, we really give a big dent into that 75 million people who are eligible but not vaccinated, we will turn this around from the standpoint it will no longer be an outbreak. It will be there. You're not going to completely eradicate it. But right now, we are in outbreak mode. We have 160,000 infections per day. That's pandemic. We can get that way, way down. We may not get rid of it completely. You may see intermittent cases that'll come and break through, which will be manageable. It will not interfere with our lives. It will not be a public health threat.
Yeah.
How soon we get there is dependent on us. It's how soon we get those people vaccinated who are not vaccinated.